So, good evening, everyone. Let us start our unknown class. I hope you can hear me all. Can you hear me, everyone? So, let us start. I hope I am audible to every one of you. Can you hear me? Just write me. Good. Okay, fine. So, let us start. So, I am just going to discuss with you all again today regarding the medicines, that how medicines work. We have been discussing this from yesterday, and on that we talked on four of the aphorisms: 30, 31, 32, 33. So how this topic is coming here, the topic is coming here reason that if you see the last line of aphorism 29 says, this highly probable explanations of the process rest on the following axioms. Or in the sixth edition, the line is slightly different. The most highly probable process rest upon the following propositions. When we say axiom, when we say proposition, all that means that you have something to tell you. Dr. Henneman has got something to tell us, some concept of theory. So when he says propositions or axioms, means it's not one, it is more than one, plural. So if you see the what are these axioms? The first one is talking about that how medicines work. How medicines work means how they are more powerful than the diseases, natural diseases. There must be some understanding about it. And then he's talking about the next proposition is, the next axiom is, the next theory is, if we see the interaction of the diseases, natural diseases in the organism, what happens? Maybe chronic, maybe acute. When such diseases are there, for example, we can ask a question. Somebody who is suffering with some serious chronic disease, for example, somebody is suffering with cancer, can he suffer with COVID-19? Because this is what one natural disease in the name of cancer already existing with them. And with that, what is the possibility that COVID-19 can come or not? Both are having no such similarity. Both are in their manifestations, in their presentation of the symptoms, are quite different. So, dissimilar diseases, can they come? So, ultimately, the situation will be that two dissimilar disease can be there in one person, but it depends on the severity of the one. The severity the one has will continue first, the second will continue the course later. There are three conditions, we know this. So this is the second preposition, second axiom. And in this natural disease interaction, we have one that is regarding the situation amongst the natural diseases. If symptomatology of two diseases are similar in manifestation, when symptoms are similar, then what is going to happen? Somebody suffering with whooping cough can suffer with measles. Yes, measles will come because it is a stronger disease than the whooping cough. But because both have a similar kind of manifestations, what is going to happen? The whooping cough will be going once for all, is cured. So these are the important positions. On that basis, Enman gave the modus operandi in Aphorism 29. See, whole of the theoretical part, whole of the doctrinal part of the organon, from Aphorism 1 to 70. The initial first four aphorisms are regarding the physician, the idealism of the physician. We can say ideal cure. Then he is talking about knowledge of disease. In the knowledge of disease, we get a blueprint of the organon from aphorism 5, 6, 7, 8. And then next we are going to know from 9 to 18 the dynamic concept of disease, health, cure. And then after this, when we are going to complete 18, then we are going to know about the knowledge of power of medicine, 19, 20, 21. 22 onwards that we are on, we are in the journey of knowing the concept of therapeutic law. That starts with aphorism 22. In that, he first of all tells us what should be the law. We know two law, which is easily comprehensible. They are of two: the law of similia, the law of contraria. We are to choose the one which is going to remove the disease rapidly, readily, and permanently. And another word he's using at places, surely. So on that basis, if you find out with all your experience and all your experiments, you will find it is the law of similia. On that basis, when a medicine is given, then only the disease is surely, permanently, rapidly, readily going away. But if you are using contraria, it is a transient alleviation for a short-lived improvement in a case, and then disease comes back, the manifestations come back with much more force. So we are to understand which law we all have to pursue. Then in 25 he says that after all these experiments and experiences, we come to know the law of similia. And in the 26 he explained that we can see this law from the nature, and he has given some 6 examples in the footnote. And examples are not simply from the medicine point of view, the medical art point of view. Even this law of similia is utilized in the scenario of army settings, and many more such examples we can also find out and quote. So ultimately, he told us which law, what law is applicable to cure surely, rapidly, readily, permanently. Then comes how does it cure? When he is going to talk about how does it cure, it starts with 27, 28, and 29. In this, he explains us how does it cure. Once we are going to understand this, how does it cure, obviously, how he is telling just at the bedside. His whole scenario, discussion, explanation, experience, teachings, all comes from the bedside. Bedside, his ultimate laboratory. For today, the scientists wish to know that prove this in the laboratory. Then obviously those who are interested, such scientists, they have taken homeopathy to the lab and they are working their own. We all are clinician. Let us read organon, understand organon, follow Hahnemann to prove ourselves, to prove that we can also practice homeopathy successfully at the bedside as per the teachings of the Master Hahnemann. So we are going to know about how does it really cure, the science of it. While telling science, you are to tell the theory. He is telling us the theory that is regarding the how does medicine work, in what way the interaction takes place among the diseases, natural diseases in a organism, and what is going to really teach us. So in aphorism 30, what we learned in aphorism 30, we learned that medicines are one which we know them by the provings on the healthy human beings. And if you compare them with the natural disease, what you find? You find medicines, they ultimately affect, they surely affect the human being, but it is not that possible that surely natural disease will affect. I gave you the example that nowadays, when this COVID 19 is going on, it is not affecting everyone. 100% people are not. But medicines, if you do some proving, if you give somebody a medicine, it is only that dose which is in your hand. It is you can decide that one person not getting affected with one drop, you can just go ahead with drops 1 to 10 to 100, and ultimately there is a point comes when it is going to affect. One very good example I reminded just now. If you really want to understand that medicines surely affect, then let us find out one example in that somebody has got an innate immunity from something, and a medicine which can generate such kind of disease beyond the innate immunity. I give you an example. There is a medicine called Drosera, every one of us know. And cats are having innate immunity against tuberculosis or such disease. But then if you feed cats with the Drosera, after a particular time, they develop the effect of the Drosera as improving in such a way that they get a tuberculosis-like disease for which they have a innate immunity. This is the impact. It is going to be affecting the human beings also. So the same in this aphorism, he is telling us the human body appears to admit of being much more powerfully affected in its health by medicines, partly because we have the regulation of the dose in our own power, then by natural morbid stimuli. For natural diseases are cured and overcome by suitable medicines. When he says he is using a word for means here that this due to this natural diseases are cured and overcome by suitable medicines. So we are to understand going to affect the human organism, the human economy, surely. And one of the reasons for that is that the dose is in the hand of us. We are controlling the dose. But at the same time, natural disease, They have nothing like this. Then going further to the next aphorism, if we see aphorism 31, here three things to be understood properly. One, that is partly psychical, partly physical, in context of inimical forces. We all understand that we are going to be affected dynamically only. We do not affect materialistically. And in this context, the footnote is also there. When the question of acute diseases, infectious diseases comes, because of our erroneous orientation towards the infectious diseases, our mind goes always towards the materialistic concept of the disease, that virus has gone in and we got it. If we have such kind of ideas in our mind, if we are impressed with such kind of thought, we cannot treat such infectious diseases successfully, because we will not be knowing exactly that what really happened with the person before falling sick. So we are to understand that these inimical forces, all those forces which are going to influence us dynamically, which are going to influence our vital force dynamically, they are of in the two groups, maybe psychical, maybe physical. And for example, there are patients, there are people, those who are suffering with lot of anxiety, they are getting diseases and they are much more susceptible towards this newly going on disease COVID-19. It's a psychical factor which is working more towards the occurrence of the disease. And it is very important for us to know that what is that causing the illness. So, inimical forces, morbid stimuli, and there is one more word, morbific cause, and morbific noxious agents. They all are talking almost the similar kind of things, that natural morbid stimuli in aphorism 30, in 31 inimical forces, then in the second line 31 morbific noxious agents, and then comes morbific cause. All these are the words which are telling us, which are there to understand that all these words are to understand all those dynamic powers influencing our vital force. Then only any materialistic substance come later. So we are to understand in each case, patient is coming with a couple of symptoms. Maybe a diarrhea, maybe a fever, maybe a throat complaint, maybe headache. You have to understand what happened before this. Don't get influenced, doctor, or these symptoms are going towards the indication of COVID-19. Should I go for test? It is, one different line which is being taught. But if we see what happens, what after test? All right, I'm not against test. Get it done. You got it done, it came positive or it came negative. What next? Patient is suffering with fever, headache, maybe diarrhea, maybe pain throat, maybe breathlessness. What next? He requires, as per our homeopathic system of medicine, a indicated medicine, a remedy similar to such symptoms. And the difficulty for all of us is they are coming to us after doing certain kind of treatment. We got fever yesterday night. Immediately we took one kind of antipyretic tablet, maybe crocin or something like this. Then tomorrow morning we went to a chemist shop and we took a dose from him for this fever. What they are doing generally, chemists are generally giving you one antipyretic, one antibiotic, one anti-allergic, and like this some 4 or 5 pills, maybe including some kind of steroids or like this. But then they are giving you a combo treatment, and you are quite wise enough to take them all. And now they are coming to you after some 3 days that fever is not all. And until and unless ask them what kind of medicines you all have taken, they will not be telling you. Now, what is the remedy? We are to find out what inimical forces, partly psychical, partly physical, affected him to make sick. Forget, just keep aside in your clinic seeing a patient that it is a virus, it is a bacteria. Keep that aside. I'm not against that, and I'm not saying it is not causing disease. It is one of the cause of it. But we have to find out how we invited them, what lacked, what actually affected our dynamic vital force, what are those. The best way will be, you first of all, when a patient comes to you second day, third day, some patients are coming, we are feeling this complaint and immediately we are calling you. Very good. These are the very virgin cases, very easy to treat. But then patient comes after 2 days, after 5 days, he just be assured he has taken some treatment. We are not against any treatment, but then for giving our treatment, we need to know this inimical forces. So the best way is, you just come to know when they took the first pill and they tell that when we got 101 fever, we took this one pill. All right. Now, you ask all the details before having this pill. What all has happened? And that is going to give you the real virgin picture of the whole case. There only you will be able to know that patient told that my AC was running at a very low temperature and I was not really well covered. And I got exposed with this chilled AC for more than 2 3 hours. So, this is what a physical inimical force influenced us. That is, this inimical force, physical inimical force, affected us. Until and otherwise, anything which is going to make this whole in our complete dynamic maintenance, no virus or no bacteria can enter. So, I'm again and again telling, be get yourself oriented with this very aphorism, that all those natural diseases, what we know as infectious diseases, any bacteria, any virus cannot simply enter into the system without getting this kind of bent, without getting this kind of effect of some inimical forces. We are to trace that one. I'm not saying for today's epidemic you do this. Whatever may be the acute illness coming to you, nowadays there is a fashion talking that diseases. I'm suffering with fever because in my family, uh, my another member got fever. Because of him, I got it. It's a new fashion has come up to tell you that I'm suffering with the disease, this fever, because my son, he got it first. I'm not saying that this is not possible. Some source is must be there. But then how you accept it? How you accept it? This acceptance means that somewhere some of the inimical forces, maybe psychical, maybe physical, influenced you first and made you responsible for getting this infection in. So these are the three, means the two things, the inimical forces, and the second is susceptibility. So this inimical forces, that is related to the environment, and also it includes all those microbes. They are also the part of the environment. They are there in the environment. And our hostness, that is the susceptibility. That how I am giving a door open, come, come into our cell and enjoy. Breed here. We invite. It is an invitation from our side. Microbes do not know they are here to make us sick. Neither they have any intention to make us sick. They do not know about it. Came first on this earth before than us. I don't know any buffering. Are you able to listen me? Hearing me well? So this inimical forces is something important for all of us to understand. We are to learn, keeping in our mind that it was never there. We were not knowing it properly. That we only came to know one connection and we established as one-to-one relation. But that's not true. After knowing lot of modern immunology, this concept is getting picked up. But it is not a one-to-one linear connection that this X virus caused this X fever. This X bacteria caused this X fever. It's not that way one-to-one connection. You need environment inside. You need environment outside. Inside environment, we call it as homeostasis. Some breakage in the homeostasis has occurred. Something happened that we were not able to acclimatize with our outside environment. My inside environment could not really sync properly with the outside environment. And in this discoordination, in this discord, the opportunity is taken up by bacteria and virus. That's the true story of getting sick by the virus and bacteria. And very, very erroneously, they are connected one to one. If my internal environment, that is the homeostasis, and the outside environment, if they are in sync, any of the bacteria or virus, whatever may be the name, does not get chance to get in and cause us illness. Does not get that chance. So it is this sync of internal environment and the outside environment. This sink, the internal environment here is called susceptibility, and the outside environment is inimical forces, psychological. Psychological is the other part, but then all these factors, somebody suddenly heard a bad news, psychical in nature. It has come from the social environment, outside social environment, and you heard, and you suddenly get sad about it. When you get sad, your homeostasis gets sad. When you get sad, your immunity gets sad. That is where this discord between the internal and the outside environment takes place. This discord, when takes place, these so-called bacteria and viruses, they get chance. And it is a very refined kind of discord where one group of bacteria or virus, they only get chance to affect us. So the whole scenario for us even to prescribe, we need to understand this very important inimical forces. And for that we have to understand this. Let us be reoriented ourselves. Let's reorient ourselves with this aphorism that natural diseases, before all this bacteria and virus, there is something, one more step before that. That very step is very important for every physician and clinician to understand, but especially for us homeopathic doctors, is something very important to understand. If we don't understand this, it is lost. It is not going to work well. For partly partly physical, to which our terrestrial existence is exposed. It is the outside environment, what kind of air, what is the temperature, what is the humidity, how is the pollution on the earth, what kind of water are we taking. That is only the source for airborne diseases, waterborne diseases, right? Like this. And on that basis, we exist on this earth. Terrestrial existence is exposed, which are termed morbific noxious agents. All these examples I am giving you related to the psychical or physical, they all are nothing but to be called as morbific noxious agents. Do not possess the power of morbidly deranging the health of man unconditionally. Then what? But we are made ill. Our organism is sufficiently disposed and susceptible to the attack of morbific cause. First of all, we must be sufficiently exposed. You can say a quantity of the, in terms of quantity, in terms of duration. And secondly, how I am reacting to that, my susceptibility, my reaction. Like when there is lot of scorching heat outside in the summer weather, if you see like Rajasthan and such places, they cover their head with some kind of turban. It is what? It is the way to somehow reduce that exposition to the scorching heat, to the sun. It is some kind of safety. If you, by that, what you are able to do, you are trying that this sufficiently disposed, you are not really allowing too much of exposure to the sun. If it is so much and your reaction is also severe to that, leading to a disease and susceptible to the attack of the morbific cause that may be present, and to be altered in its health, deranged, made to undergo abnormal sensations and functions. Hence, they do not produce disease in everyone nor at all times. So, simply, he says diseases are not unconditionally occurring. There are conditions. What are those conditions? Conditions are that how much you are disposed to it. Secondly, that how much reaction you have given to that. What susceptibility and what amount of disposition to that. What amount you have exposed to those forces in your social environment and in your physical environment. Recently, every one of you know that the whole environment is a very, very mentally sick environment. A kind of mass anxiety going around in respect of the disease. In this base of mental scenario, suddenly a news comes that one of the Bollywood actors, one that Rajput, committed a suicide. A sad thing, and definitely related to his very personal life, whatever it may be, and so many other things are coming. But you just see around. I'm seeing how people got affected with that. I'm hearing with some or one or two patients that how much sad they have gone. You just see because already they are into this anxiety of the illness, and they might be liking this actor very much. They must be having some kind of psychic relation with the personality of the actor. Yes, it is there. I'm not saying such things are not there. You see your social environment, how it is affecting so many. I'm not going into oh, why this happened, who has caused it, who has triggered it. This is not my point of view. This is not my domain. My domain is to understand how it is affecting the society. You see the youngsters, how they are affected. So, this is how you are to learn. And the one who is suffering with this kind of thing, they are popping up with so much of effect of the disease because they got exposed to such condition and their susceptibility is overreacting to the whole scenario, and ultimately perchance in this moment some bacteria, the protection, the security is compromised and they got the chance. That's a problem. That is where we are to understand all this scenario. We have to keep this thing in mind. A patient of a younger age coming, he immediately we need to know that are you affected with this scenario, or he may also say so. Let us give due regard to such kind of happenings. If we really want to practice the holistic approach in the whole, this is the holistic approach. Be careful what is happening around in the social environment. Be careful what kind of weather it is. Be careful what kind of pollution we are in. And be careful how the one you're seeing, how the one patient you are treating, how actually he is reacting to all this. Until and unless we understand this dynamic relationship, because this is a dynamic relationship. The homeostasis, that is the inside environment, and the outside environment. The homeostasis not only physical, the homeostasis in the psyche also. If you read Sigmund Freud, he will tell you the defense mechanism in the psyche. So it is the homeostasis inside the mind also, in the body also. So we get homeostasis in the both area, as he's saying. And outside the social environment, outside the physical environment, and life exists with the dynamic balance of it. They are trying always, constantly. They are in the constant action and reaction to each other to maintain a balance. Anything, maybe suddenly, maybe constantly, some irritating factor. If it is there all the time, this very sync breaks. This dynamicity, this dynamic balance, this dynamic harmony is somehow get halted. It is only this moment, especially the infectious diseases. We are to find out this very moment which is responsible for this discord, this breakage. And we have to see after this break in, then how we reacted to that. Our reactions and all those things together, they are going to give us a totality. And we have to match it with a medicine which has got the same similar totality. And we have to see the intensity and prescribe the medicine along with a suitable use. And it is going to be a salutary one, a curative one, surely, rapidly, and permanently. So this is something you will be finding about all this. We will be a little more going into. We will be a little more going into the understanding of susceptibility and all, but I think the time is running. Because of some urgent reasons, I started late only. So tomorrow, once more, we will be discussing this area in little more detail, especially the susceptibility area and all, so that we get more clear about it. So for today, thank you very much, everyone. Looking forward for your comments, your questions in a group, in a live chat, in a video comment section. Tomorrow, I believe that you should read this, find out your questions, write me. Tomorrow, let us correct at the right time, 5, 5, 10. Thank you very much, everyone.